services, and we just have really a lot of unique and wonderful behavioral health services that we offer, and we collaborate with our Indian Health Service all the time. So we have monthly meetings with them. So we know we're not overlapping services, or, you know, if we're finding out, you know, different things about relatives, just so we can have like more a wholesome approach to that unique individual that we're serving. We also have a team of adult services, and we help a lot of the adults in our community. That includes the arms work and the mental health case management. We have the elderly waiver services. We help with transportation if they need to get different places or to the mental health appointments. We have the CADI waivers available if need be. But I think our team is spread all over the nation. So so many people are getting word that we are out there with that we want to help them, and we have all these services. So more and more people are connecting with us if they see us out in the community. So I worked in those fields for a little while, but now I have moved down to the Abanuji Mo Wigamig, and that is the Children's Healing Center. So that is a residential facility, and we have more information that we're going to share with you in a minute here. Next slide, please.
So one of the things that's really important to us as an organization is, excuse me, my alarm just went off, is decolonizing our approaches. And so what does that mean? Well, it means a lot of different things. I think this is definitely made in part possible through the American Indian Child Welfare Initiative, which is an initiative in collaboration and partnership with the state of Minnesota, in which tribal nations are able to gain financial responsibility and legal responsibility for child welfare cases. And it really was a result of the disparities that we see here in Minnesota with the out-of-home placements for Native American children. And it allows us as a nation and as an organization to determine, you know, what our best practices are and how we want to approach it in working with families. And so one of the first things that we did, we were in the planning phase of this initiative since it was the 2017. And we actually went live with this implementation phase just this year, right in the middle of a pandemic, January 1st, 2021. And so now we have completely broken away from the county, which would be Beltrami County, and we're doing everything all on our own. We utilize our own court system. We have our own processes, our own policies, and our procedures. And so one of the things that we created was an Anishinaabe intergenerational family wellness practice model that is rooted in Anishinaabe language, culture, tradition, beliefs, and values. And what we do is we train all of our providers on our practice model, and it's a framework for the work that we do. And included in our practice model is our history as Indigenous people. And we talk about the historical and intergenerational trauma that exists through the multiple eras in our history, including, you know, colonization, assimilation, removal. I think a lot of people know about the boarding school era. And also in addition to that, even there's an adoption era. So there's a history with why there's so many children even in foster care, right? And so we talk about all of those different pieces, the impacts that we see today. And we're really going through this truth healing and reconciliation process where we acknowledge that history, we acknowledge that trauma that exists, and in particular, you know, even to child welfare and the trauma that has happened as a result of this system, and us really looking at, you know, what are the best interests of our children, Native American children, what are the best practices in working with our families, and how can we keep families together, and how can we prevent trauma from continuing to happen. And so these things are really important to us, and we train our providers on all of this. We talk about that history, and then we do things like we've set up foundational values and principles. We honor the 7 grandfather teachings, and we ask that all of our providers treat people with respect and kindness and love and compassion, to be non-judgmental, to be strength-based, to really help uplift our relatives that we serve. And even with the changes in our terminology, we no longer refer to the people we work with as clients. We refer to them as our relatives, because it's more relational. It's more connected with our foundational beliefs and that interconnectedness that we have with all of creation and all of life, right? And so we train and we teach our providers on the 7 grandfather teachings, you know, EnanokiidIzhitwaawin, love, Debwewin, truth, Guayako-Diziwin, honesty, Zungadeawin, bravery, Nibwakawin, wisdom, Manaji-Idiwin, respect, and De-Diziwin, humility. And as you can see in even some of similarities like this Idiwin, so like Zagi-Idiwin, well, that Idiwin, what that means is it's a reciprocal process. It's a reciprocal relationship. And that, and so the Ojibwe language is just so beautiful, so rich, and so descriptive, that there's just so many lessons in itself from just even learning that Ojibwe Moan. And I don't know if Veronica has anything else you would like to add as far as it relates to our grandfather teachings and the significance of Ojibwe Moan.
Oh, you sounded beautiful.
Okay, I just didn't know if you had any
said it right.
And I think a big one, you know, is that humility, right? To be humble and to self-reflect on our processes, because we make decisions about human lives, right? And we have to make sure that we're well-grounded, that we're connected, that we're taking care of ourselves, and that we're focusing on our own self-care, and that we're treating people in a good way. And that's what we emphasize through all of our providers. We can move on to the next slide. Some other ways in which we are decolonizing our approaches. As you can see here in the pictures, these are some of our medicines that we use daily. And one way that we can help heal our people is by acknowledging and utilizing our medicines. And so you can see here that we have sage, and we have our tobacco, and we have our sweetgrass, and we have our cedar. And we actually provide teachings to our providers and to the relatives that we serve on these different types of medicines. We've actually have medicine bundles that we are able to provide, and then also provide that teaching and significance, how to use these medicines, where do you find these medicines. And Veronica is one of our cultural coordinators. We actually have 3 cultural coordinators, and we have 1 cultural coordinator who we have a contract with. So this is very, very important to us, right? We do things like sweats. We do things like pipe ceremonies. We do things like cedar ceremonies. So there's just a number of different cultural and spiritual components that we bring into our everyday practice. And another piece too, as well, that I know I had already mentioned, that, you know, that because we are a non-PL 280 state, that the state law does not apply within Red Lake Nation. So what we're really doing now is we're really digging deep into the federal language, because what we have to follow is those federal standards and those federal guidelines. And so that's what we're focusing a lot of our attention now, is really understanding from that federal perspective. Okay, what are the requirements that we have to follow? And really the state has just been so awesome to work with. Sherry Goodwin had set the stage for that in all of her partnerships and collaborations. And so it's just been a really great experience working with the state. And they've just been so kind, and so that's just been awesome. Another piece is that, so anywhere else in the nation, people have to have 4-year degrees to be case managers. So here in Red Lake Nation, the qualification is that they have to have community and cultural knowledge. So that what that means then is that, which is why we've built such an awesome training plan, an onboarding training plan, is because we are providing them teachings to our staff to you know, ensure that they have those foundational skills and abilities that we feel are really important as being providers for Ombim and Dwa. Another piece of how we're decolonizing our approaches is that we are really big on data sovereignty. And so we've negotiated or in agreement with the state of Minnesota on just certain data elements as it relates to child welfare, which includes AFCARs. I don't know what the acronym is right now off the top of my head, but that's just one of the federal data elements. So basically, we're providing to the state what the feds are asking of them. And then we determine what's important to us as far as the data that we feel is important to share. We want to protect our people and their stories. And we know that how we share stories and how we frame stories makes a significant difference, right? And we want to make sure that we are being uplifting. We want to make sure that we are sharing those protective factors. We are sharing the natural supports and that we're really balancing out these people's our people's lives and their story, and we want to honor that in a good way. And so we've successfully been able to protect our data. And other ways in which we are decolonizing our approaches are things through like this tribal state agreement, where the state and the tribal nations create an agreement and how we're going to work together, how we're going to partner together for the best interests of Indigenous children and Native children in Minnesota. We have things like the ICWA Advisory Council, in which they meet quarterly with the state and make sure at like the macro level that we're really making decisions that make sense to us, right? We know that we have the solutions to the problems and the barriers and the issues that our people face. And we know that culture, right, identity, our spirituality, our beliefs is part of that solution. We want to acknowledge our strong leadership, and we want to acknowledge that we wouldn't be able to do this work without having strong leadership that support us, that believe in the work that we're doing. And so we wanted to acknowledge that. We wanted to acknowledge that how supported we feel as a staff as well. It's not only about the wellness of the relatives that we serve, but it's about our own health and wellness. And so, we're just so very fortunate to be able to have a leadership that supports us, that also, how we are strength-based, we're uplifting to our relatives, and that's how we're treated. We feel valued. And I'm never going to leave. I just absolutely love the work that we do. I feel valued. I feel appreciated. And we know that makes such a significant difference when we have a good supportive work environment. Next slide. So we wanted to emphasize that trainings is really important to us. Learning and growing every day is so important to us. And so we actually have way more trainings than this, but we pulled out just some of the culturally specific trainings that we did this last year through a collaboration with the University of Minnesota Duluth and the Tribal Child Welfare Training Academy. So some of the trainings include, we've trained on culturally restorative practices with Estelle Simard and Dr. Priscilla Day, decolonizing social work practices, self-care and mindfulness with Dr. Michael Yellowbird, truth healing and reconciliation. We viewed the videos or documentaries, Dawnland and Blood Memory with Sandy Whitehawk and Dr. Priscilla Day. We also trained on cultural humility. And cultural humility, basically, it encompasses all of those areas of cultural competence, but then it goes even further than that. It talks about the power imbalances that exist within the system and the individuals that we serve. And it also acknowledges the systematic accountability as a system. And then we also trained on the Indian Child Welfare Act and the Minnesota Indian Family Preservation Act.
So I wanted to dive in a little bit deeper real quick and show you the work that I get to do, that I love to do. And it just fills my soul and my heart. In the beginning, I told you guys I'd like to dabble in like learning culture and sharing culture. Well, this is this is it right here. I've been in my new role at the Children's Healing Center for about 4 weeks now, and here's some of the things that we're doing. We really focus our programming around like seasonal activities. So when we schedule their week for the youth, we make sure that we're taking in consideration is what's happening now in our community, what's happening now with the environment around us, what is going on. And we have like this overall whole person wellness idea of what we want this space to be. So not only looking at just not looking at mental health, we're looking at whole person wellness. So being active, eating well, just everything that's going to fill our bucket and make us healthy. And we collaborate with the community as much as possible. We connect with different programmings around the community that are doing cultural activities. So we're not reinventing the wheel, otherwise doing the same things that other people are doing. We have a big community outreach where I'm connecting with different community knowledge keepers to bring them in and teach us things, otherwise to bring the youth out to them or into the woods to learn different things. And we really are big on getting elder guidance from our community members. So what are the teachings that are unique to Red Lake Nation? And it goes back to the reciprocity. So what we're doing with that relationship building within community is we're teaching the youth how do we as Anishinaabe show the reciprocity. And that has a lot to do with ceremony. It has a lot to do with protocols and gifting each other. So we share that knowledge with them, and then we put it into real life practice with the youth. And then we also do a huge community give back. So we don't call it community service, not at all, but we call it community give back. So it's like building and uplifting our community as well. Next slide, please. Oh, sorry, just a second, go back. I forgot to touch on the image there. So I just put that quick image on there. It has our months, and that is a calendar, and that's like our Anishinaabe calendar, and that's what we kind of go by a little bit and just try to idea of what we're going to be looking at for the different months. And we have more months than just 12 months on our calendar. We have 13 moons. So okay, next slide, thanks. So here's an example of some of the things that we started. Last week was our first week that we have implemented walking every day with our whole staff and the youth. So we are going out in the community every single day. And cool fact, we have our very own sidewalk now in the Red Lake Nation. It was just opened last week, so we're super excited about that. We also have yoga, that we have a yoga or an Ojibwe Red Lake native yoga instructor that she comes to us once a week. Here we are sitting outside, getting the sun rays, doing yoga. Some things that we hope to get in the future are bikes for all of our team to use so we can go on community bike rides with one another. We already purchased a state park pass so we can go to the state parks and go hiking. We have connected with another agency in the community that has canoes. So we're going to really teach them how to learn that old lifestyle of canoeing, because Ojibwe people are, you know, through our history, we are canoers. So we want to get into that and get our blood memory going, right? We also are going to work on Ojibwe winter games when winter comes. We have dreams to have a weight room so we can still continue to be active. We also have, like I said, basketball players are huge here. We also have basketball players who work with our youth now. And so they're going to be helping us out, learning different ways to be healthy through that. And then to help with more cultural things, we're going to go to our community powwow spots and have like a practice day for the singers that work for us, and also the youth that want to learn how to sing and also want to practice dancing or learn how to dance. Next slide, please. And then here last week, and this goes back to going with the seasons again. So we had to connect with a artist in our community, and we asked her, can you teach us how to make baskets? What baskets are available right now? And she said, well, right now, this week, this 4-day span is meant for birch bark making. So we had to go with that. So we went out into the woods, took the youth, we showed them how to peel birch that's environmentally cautious and that's gonna keep the tree intact. And then we brought it back to our agency And then we learned how to make these baskets, and that's our end product is the baskets. And we can use them for ceremonial purposes. We can use them for harvesting or gifting our elders or whatever we shall, you know, need them for. Next slide, please. Here's another thing that we're really focused on. You know, I said whole wellness. Well, we're taking into consideration what is sovereignty. I have a background in food sovereignty. I have learned a lot about the foodways in our community. So not only like planting, but also what are the wild foods in our community? How do we, you know, work with them? How do we introduce them to our diets? And, you know, over practice, over time, like we want our center to be just full of Indigenous food. So this was us last week planting our huge garden. We're doing a Three Sisters garden, corn, bean, squash. And then we have some other things that we connected with another community program that has gifted us some seedling plants. And that's one of our workers right alongside. I think that was his first time planting corn. So it was really cool. Next slide, please. So here is another example going with the stages of, you know, the environment. Here's us also doing food sovereignty, putting it into practice. So here's the wild foods that we've been out. As you can see in the middle, there's a book there, and that is a field guide that me and another worker, we all participated and we made that for another community, but we utilize it heavily within our agency, not just in the Children's Healing Center, but we use it for all of our programming. And then right along in that book, I took a picture of like the stages of when these local plants are available. So kind of, you know, giving us an idea of when to plan for those things. So we have wild leeks that we harvested down there. Strawberries are in right now. So we're taking the youth out Friday to get some wild strawberries. We're excited. Last week we got spruce tips, and then next slide, please. Then we've used the spruce tips and the fish. And when we had a ceremony, we were able to use the spruce tips, show the youth how to use the spruce tips. And so we're just gonna be teaching a lot. Last week, we had our very first drumming on Monday. So that's gonna create a space for us to use our culture, come together and dedicate time for us to be together, not just spread apart and doing our own thing and working, but really creating community within our, you know, healing center. So this is all putting into practice food sovereignty, but also culture and reciprocity. And through ceremony and protocols, we can really put that into play and into action and give a platform for our youth to practice those life ways. Next slide, please. And just wanted to toss this out here. Not only do I do food sovereignty stuff, but I also do Awasiak stuff. So animal stuff, huge thing. And why that's important with this is because that shows the relationship, our Anishinaabe worldview with all of creation. So not only like the food and putting into practice that and with one another, building relationships with one another, but building relationships with the animals all around us too. And so moving forward, we'll be letting them learn how to build those relationships with the animals and giving them real life opportunities to volunteer for their community and the animals within the community. Next slide, please. And this is our very last slide. So that really concludes our presentation. I don't know how we are doing on time, but if we do have time, I do have a song. Otherwise, we can go right into questions.
We have some time. I did just want to emphasize a few more pieces, just that, you know, all of these different teachings that beautiful Veronica just shared with us and all of the things that we're doing with our youth. We also are available and ready to do this with all of our relatives. We want to teach. We want to provide these teachings to everyone that we work with. And beyond that, we can also provide teachings on grief and loss. We can provide teachings on our creation story, our migration story, share teachings about our history, how to pass tobacco, all of these things that Veronica had emphasized. And then what I just stated, it's available to every single person that we work with. Whether they're involved in our programs or not, you know, this is valuable to all of us. It's part of our collective healing. And so I just wanted to emphasize that piece too as well.
All right, I'll give you guys one little song. This is a grandfather song. I really like to use this song because it fits well with everything. It also allows me to just get in the zone. It's a form of meditation and healing. The vibrations, we do this too. Hey Yahweh, hey Yahweh, Yahweh, hey Yahweh, hey Yahweh, 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 hey Yahweh, hey Yahweh, Yahweh, hey Yahweh, hey Yahweh, Yahweh, yeah, Yahweh. Hey Yahweh, hey Yahweh, Yahweh, hey Yahweh, hey Yahweh. Miigwech, thank you.
Ahoy, miigwech. Thank you, Veronica and Andrea. All right. So I also have the pleasure of introducing our case study and Dr. Adele Demian.
Thank you so much. I just want to first start out by saying thank you so very much to Andrea and Veronica for their important presentation on their work rooted in healing and decolonizing and community and cultural education. That was just beautiful and fascinating. And I learned so much, and I would love to hear more about the program as you continue to work with your relatives. Real quick, before we get started, were there any questions while we have everyone here? Before I present the case study, I want to make sure everyone has a chance to ask any questions. All right, well, you guys just knocked it out of the park. So I guess everyone is just processing and taking all that wonderful information in. Thank you again so very much. All right, so today, I think most of you know me by now. I'm Adele Demian. I'm a research associate at the University of Minnesota at the Institute on Community Integration in our Tele-Outreach Center. I specialize in the assessment and intervention for early challenging behaviors and in studying the early development of any challenging and interfering behaviors. Today, we'll be talking about a case. Go ahead to the next slide if you don't mind, Lucy. Thank you. Today we'll be talking about a child who could be between the ages of 12 and 24 months. It didn't specify, unfortunately, in our case document today. However, this child lives in an adoptive home. Go ahead to the next slide. And this child was born after being exposed to substances in utero, and those substances included fentanyl, heroin, methamphetamine, THC, tobacco, Vicodin, Xanax, and Adderall. The birth father also abused substances and died, unfortunately, shortly after the child was born, tragically. This child did spend 2 weeks in the NICU without treatment. After 2 weeks, the child was treated with methadone. When the child was discharged, this child would sleep for about 15 minutes at a time, and they were extremely sensitive to sensory input. This child's original diagnosis was NAS and torticollis, and they currently live with an adoptive parent. This child does experience tremors, and they did experience tremors for about a month when they came home. And they also unfortunately had an excessive startle reflex. Go ahead to the next slide. So a couple strengths for this child include a great family support network and some compliance, it looks like. And this child also had a 3.5-year-old adoptive brother who also had NAS and was making very good progress at the time. And now on to some of our challenges. So a couple of barriers for this particular child included the fact that he had some sensory needs and that they were very difficult to determine and meet. So they were having a hard time identifying exactly what was going on. They weren't sure if it was vision or vestibular, motor skills often affected his balance and and they were also visually having some difficulty assessing the environment. So the primary concerns here for this child included frequent falling, inability to see obstacles in their path, engaging in pushing furniture, hitting, throwing, and rocking. Caregivers also reported that this child would only push objects. They used to bite and pull hair, and their expressive language was delayed. So they had a few signs. He would shake his head yes and no. He'd point and could follow simple directions, but did not have any words yet. So this child is below the first percentile for height and less than 60% for weight. So a little bit delayed in those areas as well. Next slide, please. All right, so I think, oh, one more slide. Thank you. So the integrative care strategies that were tried and that were somewhat successful that were included, parents were instructed to help the child accommodate his sensitivities to sensory input. However, unfortunately, this approach was non-effective. So they tried compression vests, they tried a weighted ball and bean bags, brushing, infant massage, and joint compressions, balance activities, other strategies such as rocking, swinging, and getting pulled on a blanket. And the mom had also decreased the visual clutter in the environment to help facilitate some of those skills. And they recently found that being in a small and enclosed space, though, did help him calm down. Next slide, please. So the goal for this child included obtaining age-appropriate speech, effectively meeting his sensory needs throughout the day, and walking without falling. So with this in mind, in your breakout rooms today, please identify 3 recommendations for encouraging this child's development in these 3 areas of need. Remember, select one person from your group to report in the chat what your recommendations are when we come together again. And of course, we can always unmute you, or you can go ahead and use your video to share out with the groups. Do we have any questions before we go out into the breakout rooms?
This is Kat Taminga from MDE. I do have a quick question.
Yes, go ahead, Kat.
And I may have just missed it, but since we're focusing on Native families today, is this child from an Indigenous family?
We do not know that.
Okay,
yeah.
okay, just wanted to check.
Yeah, part of these cases, Kat, is that making sure that the identities of these families are kept as private as possible. So we don't include demographic information typically, so we don't necessarily know. But if among your group you would like to talk about that, since we had such that great presentation, I would go ahead and talk about some of those cultural factors, how we can help encourage this child's development if they did live in those communities.
Thank you. That's exactly where I was going with that.
Great.
Thanks.
All right, we'll go ahead and into our breakout rooms. Thanks, everybody. Hopefully a couple more people to join. Hello, everyone. Welcome back. All right. Looks like we have most of our people back. Couple visitors, welcome. Everyone's welcome here in our learning space. Does anyone want to go off mute and share kind of what they talked about in the groups regarding those recommendations, or feel free to put it in the chat and we can read it. Thank you for showing that slide, appreciate it. Or this also can include, again, some of those, the community and cultural education that we just discussed in the presentation today. Hopefully you had some good discussions.
Does anyone from our group want to share? I know I took the notes, but didn't mean that I had to be the one to talk.
We'd love it if you shared, Kat.
Okay.
Thank you, Kat.
Yes, I definitely, notes don't ever capture the full conversation, but yeah. The first thing that we really talked through and that we kept coming back to is that if this child is a Native child, how, that the sensory things weren't working, is that meaning that this child isn't being connected to community and nature and the land and the cultures and traditions and ceremonies? And so how can we ensure that this child is connected with their community? Looking at things like making sure that the family is pulled into everything, and that maybe music or connection to nature. So how do you support the family in understanding how to do some of these sensory components outside, in the yard, at the park, wherever, wherever they can spend time outside with the family. So that was one of our really things that we kept coming back to in our conversation. Also, definitely looking at the relationship between all of the people who are involved in the child. There are definitely multiple parts of this family, this overall big family. And so how can you really focus on that mental health and the attachment component? For the sensory pieces, possibly that there is too much happening at once. And so how can you kind of pull back and simplify some of the sensory activities and components so there isn't maybe overload? Really centering and grounding on one thing versus everything all at the same time. And then just really making sure that there are connections between the environments that the child is spending time in and the different families of the all big one family for this child, but really kind of helping to support that switch between environments to create some consistency. And then we started talking about the speech component and looking at how are the different families and people involved using language differently, that might be also be a component. So those were some of the things we talked about. Feel free, anyone in the group who wants to add with what I missed.
Thank you, Kat, for sharing. That is a very comprehensive list. That's wonderful. I really like, the idea of being really family-centered, right? Sounded like, from what information we did have, a lot of those strategies that they were trying maybe weren't quite working, but we don't know, like, were they trying them all at once? And, making sure that we're getting the family's input around some things that are going to be feasible for them to do. Maybe they're trying too many things all at once, like you said, but also making sure it's culturally appropriate for their family and what's important to them, obviously. And so I like that idea. And I'm sure other people talked about that too, of making that connection with our presentation earlier. Thanks for sharing that. It looks like room 3 also gave some recommendations, so I'll just read them. Assuming the child is already receiving some early intervention services, having their hearing evaluated to ensure that the child is hearing clearly and properly, and there's no inner ear fluid causing impairment in the language or imbalance in walking. Asking about what the home language is. Bilingual, Kat just talked about that, discussing what types of language is being used by those caregivers and the people around that child. Any other verbal skills, encouraging language development by simplifying language, being used with the child, using lots of pictures, routine-based schedules, lots of story time, or social stories, I'm sure, as well. And then for encouraging the gross motor and walking, looking at the surfaces the child is walking on, and really looking at, hard floors versus carpeting. Is it shoes issues? Are there supports that are needed? Having evaluations done by a physical therapist, great. And then having a thorough vision exam, done to ensure that there's no impairments, and using a spot screener if available. So sounds like more comprehensive workup, maybe get more team members involved with this family to ensure that we're kind of checking off the lists of things that that we can clearly, screen for, but also help them assess, because it did say in the case study they were having a hard time in terms of like the sensory needs, identifying what was going on. And so probably either referrals or again, including more of those types of professionals within their team. Yeah, and Jessica, thank you for that that recommendation as well. The use of pictures or other augmentative alternative communication strategies to support language development, since this child has no verbal language, but is using some of those other really great strategies. So he is interacting with his environment and his caregivers and letting them know throughout his day what he wants and needs, but not using verbal language yet. So how can we support some of that verbal language with AAC as well? Excellent. Was there any other recommendations or suggestions, or again, anything related to our presentation today on that cultural education piece? All right, well, thank you so much for joining us in our community of practice and learning today. We really appreciate Project Scope. So go ahead, Courtney, or I forget, is it Lucy who has our slides right now? Thank you, yes. And I'll go ahead and turn it over to Lucy for our last couple slides here. Or I can read them if you'd like, Lucy.
You can read them, you're doing a good job.
I don't know if people are sick of hearing me talk, but I'll keep going. Thanks again, everyone, for coming today and participating. Again, you'll receive an email and complete that red cap survey about the session today. We'd love to hear any of your thoughts or feedback about it. And then again, as you know, we do offer certificates of participation, and you will be sent this after you complete the feedback survey today or whenever you get a chance. We look forward to seeing you all hopefully next week, session 7 out of 8. So we're getting closer here to winding down. Next Tuesday, June 29th, 3 to 4:30. Our topic is African-American approaches to family-centered care, and our speaker is Samira Bilal Roby. So we look forward to you all joining us, and thanks again.
Thanks so much, everyone. And a special thank you to our speakers as well.
Bye, everyone. Thanks. Judy, I'm not sure if you had to step away. It's okay if you did, but if you had any questions, go ahead and ask them. Otherwise, I'm going to go ahead and